Hey everybody, your dental hygienist here. I want to talk about healing your gums at home the non-surgical way. So most importantly, step one is go to your dentist at least 2 times a year to get proper cleanings from your dental hygienist. They're going to diagnose your gums with any type of disease, gingivitis, periodontal disease, and they're going to help you get your mouth in shape. Although a dental hygienist can help get your mouth in good shape, what a patient does at home is ultimately the most important thing. We see you 2 to 4 times a year, and there's a lot of time in between. If you're not flossing and brushing and doing suggested gum therapy, then things don't really improve like they should. So step number 2 is always proper home care, using an electric toothbrush, daily flossing, and then using a rinse or not using a rinse. It depends on what your mouth is like and what conditions. So step 3 is how to heal swollen gums and to help decrease periodontal pockets or to treat isolated acute gum inflammation. This method is one we use in the practice all the time with patients. It's called the Keys method. This is a method that was created by Dr. Paul Keys, and it's also known as the salt and soda method. This is in combination with dental cleanings, root scaling if needed. But this is something that at home can make a huge difference in a patient's oral health if they do it as instructed. So it's very simple. My dentist actually created a kind of little how-to here with the different steps. The important thing is you need the 3% hydrogen peroxide. Hydrogen peroxide is good for so many things, so it's always important to have on hand. And then next is baking soda, which most people have in their cabinet. The ratio is going to be 2 parts peroxide to 1 part baking soda. And you can use, if you're making a large quantity, you could do 2 tablespoons of peroxide to 1 tablespoon of baking soda. That's a lot. I'm not going to do that right now because I'm not really going to use this. So I'm using 1/4 of a teaspoon, and I'm going to measure the baking soda first because I don't want to dip a wet measuring spoon into hydrogen peroxide. So I'm just going to put it in my little cup there. And since I did 1/4, I'm going to do 1/2 of the peroxide in the cup. The goal is to kind of get this to be a little bit of a mixture, a little bit wet. That's kind of the ratio they want you to use, but as you can see, it dissolved too much. So what we're going to do is we're just going to kind of eyeball and we're going to add. You want just a loose paste, so you can kind of just mix it around until you get what you need. And what I'm mixing it with is called a gum stimulator. This is by the Gum brand. It's actually a little rubber tip, and people will use this with nothing on it, and they'll actually rub it under the gum line. So I've kind of made a little slurry here. And you can actually use this with a toothbrush and brush it on your gums, or you can use the stimulator. In our instructions, the doctor actually wants people to use the stimulator because he wants you to actually get it under the gum line. And I'm actually going to add a little bit more baking soda. Hold on 1 second. Okay, so I added some more baking soda till I got kind of a thick slurry, so it kind of drips off the stimulator. So you can kind of eyeball it as long as it kind of looks like this. This is kind of the consistency you want. This tastes horrible, so if you're actually going to use it and brush it in your mouth, sometimes putting a little bit of toothpaste with it will help make it more tolerable. There is toothpaste on the market, you know, like Arm & Hammer, that has baking soda and peroxide in it. It's probably a pretty small amount. So this is used to treat acute gum issues, inflammation that kind of just cropped up. Maybe you ate something that got stuck under the gum, or you're suffering with, have not gone to the dentist in a while and you got a lot of tartar, a lot of bleeding. This is going to help speed up the healing. So what you're going to do is you're going to kind of take a little on your stimulator here, and then wherever the infected area is, you're just going to kind of put it in your mouth and then just kind of massage it under the gum line and kind of get it under there. And really it's the act of the massaging too that's going to help remove some of the plaque. and you kind of let it kind of get under there and bubble. And then after you do this for about 20 seconds or so, you're going to actually then rinse with warm salt water, and you do about maybe 3/4 to half a teaspoon of table salt, 6 to 8 ounces of warm water, and then you're going to swish all of this out. Sometimes the stimulator is a little difficult to use for patients, so you could even dip your toothbrush in this and just kind of gently rub it under the gum line and kind of brush the infected teeth. And then you're going to do this 2 times daily for about a week. 2 times daily is a lot to ask from patients, so I tell them to at least do it at night before bed, kind of make it part of their routine home care. And you should see results, within a week or so. It's important to, be under the care of a dentist and a hygienist so they can help monitor your condition and recheck any bleeding or tartar in the area. But this is a home care device technique that is simple, cheap, and very effective. Thanks for watching.